Have you ever wondered what would happen if your immune system started attacking your digestive tract? Instead of protecting the body, it creates ongoing inflammation that can damage the intestines and make everyday activities difficult. This is what happens in Crohn's disease, a long-term condition that affects millions of people worldwide. So what exactly is Crohn's disease? Crohn's disease is a chronic inflammatory bowel disease, often called IBD, that causes inflammation anywhere along the digestive tract. While it can affect any part of the digestive system, from the mouth to the anus, it most commonly affects the small intestine and the beginning of the large intestine. To understand Crohn's disease, remember that the digestive tract is lined with tissue that helps absorb nutrients and move food through the body. In people with Crohn's disease, the immune system mistakenly attacks this tissue, causing ongoing inflammation. Unlike many digestive conditions that affect only the inner lining of the intestine, Crohn's disease can affect all layers of the intestinal wall. This deep inflammation can lead to swelling, ulcers, thickening of the intestinal walls, and sometimes complications such as blockages or abnormal connections called fistulas. The symptoms of Crohn's disease can vary depending on which part of the digestive tract is affected. Common symptoms include abdominal pain, persistent diarrhea, fatigue, weight loss, reduced appetite, and sometimes blood in the stool. Because the intestines may struggle to absorb nutrients properly, some people also develop nutritional deficiencies. The exact cause of Crohn's disease is not fully understood. Researchers believe it involves a combination of genetic factors, immune system abnormalities, environmental influences, and changes in gut bacteria. The condition is not contagious and is not caused by a specific infection. Crohn's disease often follows a pattern of flare-ups and remission. During a flare-up, symptoms become more severe due to active inflammation. During remission, symptoms may improve or disappear for a period of time. The understanding of Crohn's disease has improved significantly as scientists studied the immune system, genetics, and the role of the gut microbiome in digestive health. Although there is currently no cure, many treatments can help control inflammation and reduce symptoms. Treatment may include anti-inflammatory medications, immune-suppressing drugs, biologic therapies, dietary management, and in some cases surgery when complications occur. Today, artificial intelligence is helping doctors manage Crohn's disease more effectively. AI systems can analyze endoscopy images, MRI scans, CT scans, laboratory results, and patient records to identify inflammation, track disease progression, and predict flare-ups. Researchers are also using AI to study gut microbiome patterns and help personalize treatment plans based on an individual's disease characteristics. Crohn's disease is a lifelong condition that causes chronic inflammation in the digestive tract. Understanding how it develops helps patients recognize symptoms early, manage the disease more effectively, and take advantage of modern treatments that improve quality of life. But Crohn's disease is only one type of inflammatory bowel disease. In our next video, we'll explore ulcerative colitis explained and discover how inflammation affects the large intestine and rectum.